Deep, stubborn blackheads are the ones that stop you mid-scroll because you can instantly tell they're not the average clogged pore. These are deep-rooted plugs packed tightly inside the skin, and when they're finally released with precision, the extraction is unbelievably satisfying to watch. Dermatologists pay special attention to these cases because severe blackheads form when oil, dead skin, and debris stay trapped for months or even years, creating a solid, compact core that requires skill, control, and the right tools to remove safely without tearing the skin. The real reason these extreme extractions are so captivating is because every detail matters: the angle of the extractor, the slow buildup of pressure, the way the pore visibly opens, and that clean, controlled release that shows the plug coming out in one smooth piece. Watching this process in high definition teaches you exactly how deep pore extraction works and why dermatologists follow such strict techniques to avoid scarring or pushing the clog deeper. These cases highlight how professional tools, steady hands, and proper pressure create that perfect balance between safe removal and maximum satisfaction. It's not just entertainment, it's an educational look at real dermatologist blackhead removal, showing what makes extreme blackhead extraction so different from typical pimple-popping videos, and why deep pore extraction requires respect for the skin's structure. If you want a full series breaking down the most extreme extractions, comment extreme. Some blackheads reach a level of severity that surprises even dermatologists, and it all starts with how long a pore has been collecting keratin, hardened sebum, and environmental debris. A normal blackhead forms when oil and dead skin mix inside a pore and oxidize at the surface, but an extreme blackhead develops when that buildup stays trapped for months or even years. Over time, the material inside becomes dense, compact, and almost waxy, forming what dermatologists call a hardened core. These cores don't sit close to the surface, they anchor deep inside the pore canal, which makes them far more stubborn than typical clogged pores. Skin type plays a huge role in how severe a blackhead can become. People with naturally oilier skin produce more sebum, giving pores a constant supply of material that can harden and layer over itself. Genetics also influence pore size and the rate of cell shedding, meaning some people naturally produce thicker keratin plugs. As we age, the skin loses elasticity and pores begin to stretch more easily. When a pore widens and the surrounding support structures weaken, it becomes easier for large amounts of material to settle inside without fully releasing, creating the perfect environment for deep pore congestion. This is why older adults often develop what look like oversized blackheads or dilated pores of Weiner, which are essentially long, standing impactions that have grown layer by layer. Extreme blackheads often become multi-layered because the pore never gets fully emptied on its own. Each time more oil or dead skin gets trapped, it compresses the older layers beneath it, creating a tightly stacked plug. Instead of a soft, jello-like consistency, these turns firm, rubbery, or even dry depending on how long congestion has been building. Dermatologists can tell a blackhead is severe the moment they apply pressure. It resists movement, remains anchored, and often releases in one long, solid piece because the layers have fused together over time. Prolonged congestion also affects the pore walls themselves. As material continues to build, internal pressure increases, causing the pore to stretch and sometimes darken due to trapped oxidation and shadowing. This is why extreme blackheads often look larger or darker than they actually are. The skin surrounding the pore can take on a slightly raised, dome-like appearance, which signals that congestion is sitting deep beneath the surface. Some severe blackheads can even cause discomfort or mild inflammation simply because the skin has been under pressure for so long. Dermatologists consider these impactions extreme because they require precision and patience. A pore that has been stretched for years can easily tear if too much pressure is applied too quickly. The extraction needs controlled angles, steady pressure, and sometimes pre-softening techniques to help the plug release without causing trauma. These cases also give dermatologists insight into how skin behaves over long periods of congestion. They reveal the impact of genetics, lifestyle, environment, and aging on pore structure and function. The deeper the impaction, the more it shows how resilient yet vulnerable the skin can be when buildup is ignored or unnoticed. Severe blackheads also highlight the importance of consistent skincare. When pores remain congested for long periods, the surrounding skin can become uneven, discolored, and stretched, making it harder for the pore to return to its original size even after extraction. These extreme cases serve as a reminder that blackheads aren't always just surface-level issues. Sometimes they represent years of slow, unnoticed buildup that eventually turns into a solid, deeply rooted plug. Have you ever seen a blackhead this deep before? Comment why yes or no dermatologists rely on a precise set of tools when dealing with extreme, deeply embedded blackheads, and each tool plays a specific role in making the extraction safe, controlled, and clean. The most recognizable tool is the loop extractor. Its rounded metal loop allows pressure to be distributed evenly around the pore, so the hardened plug can be pushed upward without cutting into the skin. For extreme blackheads that sit deeper than usual, dermatologists often use a smaller, more refined loop to target pressure with better precision. When a plug is tightly anchored or has multiple layers, a loop gives enough leverage to coax it upward without forcing too much pressure onto a single point. Fine-tip forceps are another essential instrument for stubborn impactions. While loops help lift a plug, forceps help grip and gently pull out material once it has begun to emerge. These forceps are incredibly precise, designed to grasp the plug without slipping or tearing the surrounding skin. They are especially useful for long rope-like cores, dried keratin plugs, or cases where only the top of the impaction is visible at first. The control offered by forceps allows dermatologists to remove the entire plug in one piece whenever possible, reducing the risk of fragments being left behind. For blackheads that are sealed under a thin layer of skin, dermatologists may use a sterile lancet. This tiny needle-like tool is used to create the smallest possible opening so the impaction can be released without unnecessary trauma. A lance, it isn't used to dig or scrape, it's simply used to break the surface tension so extraction tools can do their job safely. This prevents the skin from tearing in unpredictable ways and ensures that pressure is directed upward, not sideways. Cotton tip pressure is another technique that might look simple, but it's incredibly effective for sensitive areas and softer impactions. Using 2 cotton swabs allows controlled pressure with a cushioned surface, making it ideal for patients with delicate skin or for pores located near the eyes, nostrils, or lips. Cotton tips also absorb excess oil and provide a better view of what's happening beneath magnification. Speaking of magnification, dermatologists rarely, if ever, perform extractions without enhanced visibility. Magnifying loops or specialized lights help professionals assess pore depth, angle, and surrounding skin structure. Extreme blackheads often sit deeper than they appear, and magnification ensures the dermatologist sees the full length of the pore canal. This allows them to choose the correct tool, pressure, and direction to avoid damaging the skin. Before any tool touches the skin, preparation is critical. Dermatologists start by cleansing and disinfecting the area to prevent bacteria from entering the pore during extraction. Warm compresses, steam, or professional softening agents may be applied to loosen keratin and make the plug more pliable. Prepping the skin also reduces discomfort and minimizes the force needed to release a deep impaction. The goal is always the same: soften, lift, and remove without causing unnecessary irritation. The choice of tool depends entirely on the type of blackhead being treated. Long, standing core plugs often require a combination of a lancet, loop extractor, and forceps. Wider pores with thick, rubbery impactions might respond best to larger loops that distribute pressure evenly. Smaller, tightly packed pores may need fine loops or cotton tip pressure for precision. Every tool has a purpose, and the dermatologist's job is to match that purpose to the unique structure of each congested pore. Safety is at the center of every step. Loop extractors reduce the chance of bruising by evenly spreading force, while lancets prevent accidental tearing from excessive pressure. Forceps remove plugs cleanly without digging, and magnification ensures no tool is used blindly. Cotton tip pressure protects fragile skin from metal contact, making the process both gentler and more controlled. Every tool is designed to clear the pore while preserving the health and integrity of the surrounding tissue. Extreme blackhead extractions follow a precise sequence, and the reason they're so satisfying is because every step reveals something happening deep inside the pore. It starts with the dermatologist applying gentle, controlled pressure around the impaction. Unlike forceful squeezing, this pressure is slow and deliberate, allowing the compacted sebum to shift upward in layers. When a blackhead has been trapped for a long time, it doesn't release all at once. Instead, the plug begins to rise gradually, almost like a column lifting from the skin, showing each level of hardened keratin as it moves. Some extractions come out as slow, thick releases. These are the ones where the material inside the pore has dried and compacted over years. The dermatologist applies steady pressure, and the plug rises millimeter by millimeter, creating that incredibly satisfying moment when the full length of the core finally emerges. These extractions feel almost like removing a tiny rope or cylinder that's been hiding beneath the surface, and the satisfaction comes from seeing how cleanly the pore empties after holding so much material for so long. Other blackheads release with fast, dramatic pops. These usually occur when the core is softer or when internal pressure has built up enough that the slightest controlled squeeze triggers an instant release. That sudden burst is visually striking but still requires precise technique to keep the pore walls from stretching or tearing. Throughout the process, dermatologists watch for signs that the pore is ready to release. They look at the tension of the skin, the angle of the impaction, and the way the plug responds to initial pressure. If the material shifts upward smoothly, they continue with steady force. If it resists or sinks deeper, they adjust the angle or change tools to avoid damaging the delicate pore canal. The goal is always upward movement, never pushing sideways, which could bruise the skin or create micro tears that lead to scarring. Under magnification, the moment a blackhead begins to rise is fascinating. The top of the plug first appears as a tiny dome lifting from the pore opening. This is the oxidized portion, the dark tip that has been exposed to air. As more pressure is applied, the deeper material begins to follow. You can see the color and texture shift from dark and dry at the top to pale, waxy, or even creamy as the older, unoxidized layers emerge. Each layer reflects a different stage of buildup, years of keratin, hardened sebum, and compressed debris stacked tightly inside the pore. For thick and stubborn plugs, the extractor may need to be repositioned several times to maintain the perfect angle as the material moves up. When done correctly, the entire congestion lifts out in one continuous piece, leaving behind a visibly empty pore that looks instantly cleaner and flatter. In more dramatic, fast-release cases, the core ejects in a single moment, and the dermatologist is ready with a gauze or cotton tip to catch the material before it lands on the skin. The pore immediately relaxes afterward, and you can see the walls contract slightly as tension releases. Even the final step is satisfying. Once the plug is out, the dermatologist gently presses around the pore again to ensure no small fragments remain. This prevents recongestion and helps the pore heal cleanly. The skin is then soothed, cleansed, and sometimes lightly treated to encourage the pore to tighten and reduce future buildup. Watching this process up close reveals why dermatologist close-up extractions are so popular. They highlight the deep pore removal process in incredible detail, showing exactly why these are considered some of the most satisfying blackhead pops. Dermatologists approach extreme blackhead extractions with a careful, protective strategy because the goal isn't just to clear the pore, it's to protect the skin throughout the entire process. It begins with meticulous skin preparation, which is the foundation of safe extraction. The area is thoroughly cleansed to remove surface oil, bacteria, and buildup so nothing gets pushed deeper during pressure. Dermatologists often soften the skin using warm compresses, gentle steam, or professional grade softening agents. This step loosens the keratin inside the pore and hydrates the surrounding tissue, making the plug more flexible and easier to lift without forcing it. Hydration softens both the impaction and the pore walls, reducing the risk of tearing. Once the skin is prepped, the focus shifts to technique. Dermatologists don't squeeze directly downward because that can bruise the skin and drive the clog deeper. Instead, they apply angled upward, directed pressure that encourages the core to rise rather than collapse. The extractor tool is positioned carefully so pressure is distributed evenly around the pore. For stubborn, anchored plugs, the angle may be adjusted multiple times to maintain control and prevent trauma. If the skin shows signs of strain blanching, sharp folding, or resistance, the dermatologist slows down or changes tools to avoid overstretching the pore canal. During extreme extractions, preventing hyperpigmentation, bruising, and scarring is a top priority. Dermatologists pay attention to how the skin responds to each step. If someone has sensitive or melanin-rich skin, the risk of post-inflammatory hyperpigmentation is higher, so even gentler pressure is used. They avoid twisting, scraping, or pulling sideways, which can cause micro-tears that turn into long, lasting dark marks. When a blackhead is especially deep, dermatologists may use a sterile lancet to create a tiny controlled opening at the surface. This helps release the tension without forcing the pore to stretch beyond its limit. By creating this precise entry point, the dermatologist reduces the force required to remove the impaction and minimizes trauma inside the pore. Bruising is another risk when dealing with long-standing blackheads because the surrounding tissue is often tight and inflamed from pressure buildup. Dermatologists use cushioned tools like cotton-tip applicators in sensitive areas to reduce the chances of capillaries bursting. The entire extraction is carried out under bright magnification, so every movement is intentional and no tool is used blindly. This visibility allows the dermatologist to see exactly when the plug begins to lift and when the pore walls need more support. Once the impaction is successfully removed, post-extraction care becomes essential for protecting the skin and helping the pore recover. The area is usually cleansed again to remove residue and reduce bacterial exposure. Dermatologists often apply soothing ingredients such as aloe, niacinamide, or centella to calm redness and reduce inflammation. These ingredients help the skin settle quickly and prevent irritation from turning into long-term discoloration. A gentle antibacterial or antiseptic product is commonly used to keep the freshly emptied pore clean, lowering the risk of infection or breakout. To support barrier repair, dermatologists may apply a light, hydrating moisturizer with ingredients like glycerin or hyaluronic acid. This helps restore the skin's moisture balance, which is especially important after removing a large plug that left the pore vulnerable. If the extraction involved significant depth or if the patient is prone to hyperpigmentation, dermatologists may recommend avoiding sun exposure and applying sunscreen immediately afterward. Protecting the skin from UV light helps prevent dark spots from forming while the skin is healing. These careful steps from prep to pressure technique to aftercare work together to prevent damage and ensure the pore stays healthy after extraction. It's this level of precision that separates safe dermatologist techniques from risky at-home attempts and explains why even extreme extractions can be performed without leaving lasting marks when done correctly. Extreme blackheads don't just provide a satisfying visual, they also reveal a lot about the overall health of the skin and the habits that contribute to long-term congestion. When a dermatologist examines a deeply rooted, stubborn blackhead, they can identify signs of chronic buildup that often develop over months or years. Persistent congestion can indicate excessive oil production, dead skin accumulation, or environmental debris that has repeatedly entered the pores without being fully cleared. In some cases, these severe impactions reflect a combination of factors including genetics, lifestyle, and the effectiveness of one's skincare routine. Pore size and texture offer additional clues. Larger, stretched pores often suggest that the skin has been under consistent pressure from repeated clogging or years of oil overproduction. Stubborn impactions in these pores demonstrate that the surrounding tissue has been repeatedly stressed, which can contribute to slower healing and an increased risk of scarring or hyperpigmentation. Conversely, very fine pores that still develop deep blackheads can signal unusually oily skin or inefficient exfoliation habits. The texture of the skin around the pore, whether it appears smooth, rough, or slightly raised, also provides insight into long-term congestion patterns. Dermatologists analyze these factors to understand how the skin ages over time and how repeated blockages may influence elasticity and overall tone. Lifestyle habits play a critical role in extreme blackhead formation. Diets high in processed foods, inconsistent cleansing routines, or prolonged exposure to polluted environments can accelerate the buildup of sebum and debris within pores. Even something as simple as frequently touching the face or skipping exfoliation can create ideal conditions for multi-layered impactions to develop. Extreme blackheads are, in many ways, a physical record of these repeated habits and environmental exposures, making them valuable indicators for dermatologists studying individual skin patterns. Skincare routines, or the lack thereof, also influence how extreme blackheads form. Overly harsh scrubs, improper extraction methods, or neglecting regular cleansing can exacerbate pore congestion, while inadequate hydration can cause the skin to overcompensate by producing excess oil. Dermatologists often examine the structure and consistency of removed plugs to assess which products or practices might be contributing to recurring blockages. This level of analysis allows professionals to give personalized recommendations that target both prevention and long-term skin health. Extreme blackheads are more than just cosmetic concerns. They are diagnostic tools. By evaluating the depth, density, and frequency of these impactions, dermatologists can determine patterns in acne-prone or oily skin. They may also use these observations to predict potential issues like early signs of enlarged pores, prolonged inflammation, or future breakouts. In this way, every extreme extraction serves as both a treatment and a learning opportunity, highlighting how past habits, skin biology, and environmental factors intersect to influence pore health over time. Do you want a full guide on how to read your skin through your pores? Comment pores preventing extreme, stubborn blackheads requires a consistent dermatologist-approved routine that addresses both the surface and deeper layers of the skin. One of the most effective strategies involves weekly chemical exfoliation with salicylic acid. This beta-hydroxy acid penetrates deep into the pore, dissolving excess sebum and dead skin cells before they can compact into hardened plugs. For long-term maintenance, retinoids are another key tool. These vitamin derivatives accelerate skin cell turnover, reduce congestion, and help maintain pore clarity over time. Using retinoids consistently, even in small amounts, can prevent the formation of multi-layered core plugs that are notoriously difficult to extract. Gentle physical exfoliation, such as soft silicone brushes or mild scrubs, can complement chemical exfoliants, but dermatologists stress moderation to avoid irritation or microtears in the skin. Cleansing habits play a critical role in long-term blackhead prevention, especially for oily or acne-prone skin. Dermatologists recommend a double cleanse routine, first using a mild oil-based cleanser to dissolve excess sebum and makeup, followed by a gentle water-based cleanser to remove residual debris. Over-cleansing or harsh scrubbing can strip the skin of natural oils, triggering compensatory overproduction and increasing the likelihood of clogged pores. Warm water helps open pores slightly, making it easier for the cleansers to penetrate and remove trapped material, while avoiding hot water prevents irritation and unnecessary dryness. Hydration and sun protection are equally important for maintaining pore health. Well, hydrated skin balances oil production and reduces the chance of keratin buildup that can lead to blackheads. Lightweight, non-comedogenic moisturizers are ideal for keeping pores clear without adding excess oil. Sunscreen prevents oxidation of sebum and keratin within the pores, which is what gives blackheads their characteristic dark appearance. Applying broad-spectrum SPF daily helps protect the skin barrier and prevents darkening of existing pores, reducing both cosmetic and long-term structural issues. In addition to topical treatments, dermatologists emphasize proper at-home practices. Avoid squeezing, picking, or attempting to extract blackheads without the right tools, as this can create trauma and increase the risk of infection. Instead, consider using gentle silicone brushes, clean cotton swabs, or dermatologist-recommended pore tools for safe maintenance. Regularly replacing pillowcases and avoiding prolonged contact with sweat or pollution can further reduce the accumulation of debris in pores. Keeping the skin's surface and underlying pores free from congestion ensures that extreme blackheads are less likely to develop, even in genetically predisposed or oily skin types. Consistency is key. Incorporating these practices into a weekly routine helps prevent the formation of deeply rooted, stubborn plugs. A combination of chemical exfoliation, retinoid use, proper cleansing, hydration, sun protection, and safe at-home care creates an environment where pores can function normally without becoming congested. Over time, this routine not only reduces the likelihood of extreme blackheads, but also improves overall skin texture, tone, and resilience. By following these steps, the skin maintains long-term health while minimizing the need for frequent extractions or professional intervention. Do you want a weekly pore care checklist, comment checklist?